We'd like to welcome you to our pre-recorded pilot webinar, part of the TMJ collaboration webinar series presented by Fight TMJ. This series brings together experts, clinicians, and advocates dedicated to improving understanding and care for TMJ disorders. Each session in this webinar series explores new perspectives in TMJ awareness, research, and treatment, creating a space for global collaboration and patient-centered solutions. In this pilot episode, join Dr. Bednarczyk, Dr. Werfel, and Jessamy Cunningham as they discuss the first steps in shifting the TMJ narrative. We're grateful for your interest, and we hope this conversation helps you learn, share, and support the mission of Fight TMJ.
Okay. Hello, everybody, and welcome. I'm Cameron Mulby, the founder of fighttmj.org, and I want to start by thanking you all for being here. Whether you're someone living with TMJ, a healthcare professional, or just someone who cares about this cause, for a long time, TMJ disorders have been misunderstood, under-researched, and often dismissed. Millions of people live with chronic pain, misdiagnoses, and isolation, and it doesn't have to be that way. I started Fight TMJ because I saw how little awareness and coordinated action existed around this issue. Our mission is simple but powerful: to raise awareness, fund research, and fight for better diagnosis and treatments for TMJ disorders worldwide. Today's webinar is about education, empowerment, and connection. You'll hear from Dr. Victoria Bednarczyk, Dr. Aimee Werfel, and Jessamy Cunningham, who are leaders in this field, people working on the front lines of patient care, advocacy, and scientific research. I hope you'll walk away today with more knowledge, a sense of community, and most importantly, the belief that together we can change the future of TMJ care. And with that, we are going to go to Dr. Victoria Bednarczyk. She has a presentation that she will share with us, and then we're going to go into a little discussion about it.
Thank you, Cameron. Thank you for having us. And I'm very excited to be with the co-panelists. And I think I'm able to share, which is great. So without further ado, let us start. And okay, I'm glad there's so far no technical issues. There we go, slideshow. Okay, continue to share. Can you all see my slides? Okay, perfect, wonderful. All right, so I felt that, to be able to shift the narrative and to make sure that, everyone receives the care that they should receive, when they're struggling with a TMJ disorder, I thought it'd be nice to just kind of do a little past, present, and future, because how can we know how to shift the narrative if we kind of don't know what the narrative has been, what it is now, but ideally also what we would like it to be. So it's a brief presentation. I'm very honored to be here. I have been, ever since my early days as a physical therapist in Montreal, I have had such an interest in helping people with TMJ disorders. My own sister struggled with it, and I wish I had the knowledge that I had as a PT when we were growing up so I could help her. But I just wanted to have as many courses as I could to understand and give people tools and resources and help them navigate this. I'm still taking, postgraduate courses. So really the learning never stops, even though the TMJ remains the same, our understanding of it evolves. And I think it's so important, even if you have been doing this for decades, that your thirst for learning never ends. And I have been lucky enough to also publish some research, which as a clinician, we don't always get a chance to do. It is a lot of work. It takes a lot of time, but I feel like it helps to advance the profession. And I know it's one of the pillars of the mission at Fight TMJ. So I'm glad you were able to put some of my research in the kit. And now that I'm in Boston, I am very much looking forward to helping a whole new, demographic of people struggling with, jaw, orofacial pain, and the like. So as I said, let's go into kind of the history of TMJ care, just very briefly. We'll just talk about kind of more the importance of TMJ and therefore the impact of the disorders, and then the whole history from past, present to future. So we hear the term TMJ, and technically TMJ is just the joint on the side of our face. There's a little disc, which makes it very special, but it's really an anatomical name. It's like saying knee or back. So TMJ in itself, we've kind of used it in a way to describe people who suffer with jaw pain, but really it's just the joint. And it does have parallels, as I said, with the knee because the knee has menisci, these little cushions. They're not the same, made of the same thing as the jaw, but in the sense that, there's two bones, these cushion things, so not unlike the jaw. But if ever you've injured your knee, you know that you can put a brace, you can ice it, you can put weight off of it with crutches or, um, a walker. You can definitely rest it. However, when we're talking about the jaw, so with the knee, you usually walk with the knee or go up some stairs, but with the jaw, you have to do so much more. It's the most used joint in your body. You're talking, eating, laughing, kissing, yawning. So if that area isn't feeling well, if it's hurting, how are you supposed to rest it? It's not as straightforward as the knee. And then that's where the care part obviously comes in. Who do you see? Why is it hurting? How do we make sure that you can get back to all those things that are so crucial to you and make you who you are as a person? Because if we don't talk, if we don't eat, if we can't kiss and smile, it's a big impact on our quality of life. So in the past, it turns out, even in ancient civilizations, people struggled apparently with jaw pain because they found through manuscripts a different kind of TMJ related ailment remedies. So this is not a new issue just because we are kind of treating it more in maybe recent history. This is something that has been clearly going on for a very long time. And if you think about the jaw being very used, then it kind of makes sense. And it's really kind of more in the last 100 years that we've been talking about the TMJ or TMJ issues. And it all started with an ear, nose, throat doctor called Dr. Costin, who really started to write a lot about it and was thinking that, oh, maybe the disc is an issue. It's clicking, maybe it's hurting. That's the cause of the pain. Maybe there's something about occlusion. So, a lot of theories that were current and relevant at the time that are not relevant anymore because sometimes theories in the medical profession don't evolve quickly enough. Sometimes we end up holding on to some of those old theories, but we'll talk more about that. Then moving on, I didn't actually know this until I started to research it for this presentation, but apparently between the 50s and the 70s, we were talking a lot about muscles, which was great for me to read because obviously I'm biased, I'm a physical therapist. We deal with muscles all the time and how well they use. So there was apparently this renewed interest in, no, we think it's really the muscles that are causing the pain. Let's do more conservative treatments. And then things completely shifted later with this idea of, no, it must be the disc. We can't really put the disc back. It doesn't really work. So there ended up being a lot more interest in, replacing the jaw because people were in so much pain. They thought, well, a new jaw should solve everything. The main issue was they did a horrible job deciding what kind of prosthetic would do this, and it ended up causing such a horrible scandal, medical scandal, because basically everyone dropped the ball. And so you have a very sad generation of people who really received probably some of the worst TMJ care possible that required them to have so many corrective surgeries, complete lack of trust, and a lot of the care team, even up to physical therapists. It did foster a lot of advocacy. So kind of the OG Fight TMJ would be the TMJ Association, started in the late 80s. But if anybody watching this is, in this cohort of individuals, I empathize. It was very wrong what happened. And I've seen, some of these people in my practice and, they, will always have some kind of, sequela of this, era. So it's very important for us to recognize that because, these people were really let down and we definitely do not want that to happen again. And then later on, I know we have an orofacial pain specialist among us, but dentists started to get quite interested in helping people with different, ways of going about it. But there was this kind of surge in dentists wanting to help. And then I would say in the last 10 years, we've kind of moved into this like big mix of things that we can do. We obviously do not do as many TMJ total jaw replacements as we used to do, which doesn't mean it doesn't happen. And now there are much better materials being used for the prosthetics. I have seen people with more recent TMJ replacements. I know we have Jess with us who can, talk about her experience. But, now things are much safer, and also we're much better at deciding who is a good candidate and who should have something less invasive. So there are less invasive surgical tools. There's other resources as well that we'll talk about. But I would say Botox is the one that really has kind of taken off recently. And even though we don't think of Botox as surgery, it's actually really important to remember it's still invasive. There are still side effects that can happen. So it kind of concerns me a bit, especially, with the advent of social media and Botox even being used aesthetically, but that it can be like this kind of cure-all for pain when it really isn't. So, for the kind of like current story of TMJ care, I wanted to talk about what are like kind of the more evidence-based, like what does research tell us we should be doing to help people who struggle with jaw pain? And how can you find the right provider? Because that can also be a bit of a struggle. So, usually in a medical world, if you, let's say, have knee pain, I'm talking again about the knee because it's just like a really easy way to like illustrate this. Let's say you have arthritis in your knee and your knee hurts, there is something called a clinical practice guideline. So it's basically a way for the medical community to be like, okay, these are the steps that we should take. We're weighing the pros and cons of each treatment. We're making sure that there's like a standardized way of taking care of you. And unfortunately, we don't really have that with the TMJ until very recently. So thankfully, that's the case. But for a very long time, there was no real standard of care. There were a lot of pockets of different people having different theories. And that is not good because it should be standardized. And possibly one of the reasons is that because the jaw is literally the only joint that an orthopedist will not address, it is a dentist. You can have a maxillofacial surgeon, but I mean, an orthopedist will take care of your pinky, he will take care of your pinky toe, or he or she, or they will take care of your thumb. But when it comes to the jaw, that is not at all something that they take care of. So the jaw is, in the end, like this weird outlier in the medical community. So basically, other groups have had to kind of take over the standard of care. So, since we're talking about shifting the narrative, there's unfortunately a lot of old narrative that unfortunately is still current. And I'm hoping that through Fight TMJ, through continued advocacy, people who struggle with TMJ, who've had the right care, spreading that good message, good news, us providers, making sure that like those are also being spread into the wider, healthcare community. But basically, kind of old myths are still being circulated, and it's very important to know these are not evidence-based. And I would say the main one that still floats around from time to time is that if you have a perfect bite, you will have no jaw pain. It doesn't mean that a bite can't have some impact on jaw pain, but it is definitely not the first thing that you should do. And we'll talk about what are the things that you really should start with. But this idea that like that's all you need to do and it will unlock your jaw pain is really not evidence-based at all. Another one that, especially people who might not be familiar with TMJ, maybe dentists who haven't had training, unfortunately, there's a lot of, well, just be less stressed, you're just stressed. Doesn't mean, again, that stress cannot have an impact, but it's very minimalistic to simply say, oh, just be less stressed, don't clench your teeth. That is a myth. Same thing with telling someone to suddenly change their diet forever. I mean, we cannot ask people to eat soft foods forever or, take very small bites forever. That's not functional and it impacts our quality of life. So these things can be a temporary measure, but they should not be a long-term measure. And same thing for orthotic splints. They can have definitely a role, but, you definitely shouldn't be wearing one 24 hours a day for the rest of your life. That is not going to be helping your jaw. So again, there's always, some good can come of certain things, but there's nothing that is the only answer. And the same thing for obviously exercises. I am biased. I'm a physical therapist. I know how helpful it is to work on muscles, to regain muscle balance, to help your jaw achieve better movement and opening and through the right exercises. So it always pains me when someone sees a provider and they ask them, oh, are there any exercises I can do for my jaw? And it's like, oh, well, that's not important or don't worry about it. It's a big disservice because like any joint of your body, if your muscles are not doing a good job supporting that joint, how are you supposed to have less pain and more function? So let's talk about the good news. So the good news is that we do have research that tells us, okay, what are the steps that we should take when somebody has jaw pain? So I took two sources, one from the British Medical Journal, which was kind of nice because it means that even in the global medical community, due to the prevalence, so many people having jaw pain, that they are taking this seriously, as well as a group of professionals with the acronym INFORM that do a lot of research and really want to make sure that we have standards. So this is for anyone who's had pain for at least 3 months, which we consider that to be chronic pain. I will talk about more acute pain, but basically the first thing that we start with, and I think it's so important that they highlighted this, it is patient-centered. So it is really centered around the person who is coming in front of you, who is suffering with jaw pain. This is not physical therapy centered, dentist centered, surgeon centered. This is patient centered. And then we start with conservative care. So reversible, non-surgical. And so we are going to talk about cognitive behavioral therapy briefly, PT, and they do actually recommend that some short-term like appliances or splints can be helpful as well. So CBT or cognitive behavioral therapy is just a way to help people manage pain, because if you've had pain for at least 3 months, it can start to be quite distressing. So these are tools to try to help make sure that you're not having negative thoughts that kind of create this rabbit hole that makes the pain even worse. So for example, let's say you struggle with jaw pain and all of a sudden you go out one evening to a noisy restaurant. You have to talk really loudly with your friends. Maybe the food choices are a little, tougher that you usually would like. And then you end up coming home and your jaw feels worse. So you could have kind of two thoughts. One thought is, here I am having pain again. I can never go out with friends. It's really not worth it. I'm just going to have more pain. I really shouldn't do that anymore. Or you can think, well, I know that I did more than I usually do, but I have all these tools that I was taught. I can, put some heat. I'm going to try to be careful with my jaw tomorrow. I have these exercises to help me loosen up my jaw. I know I'm going to get through this, and I'm already being on a path followed by someone to make sure that I'm going to get to my end goal of being able to go to the restaurant, but this is just, a temporary thing that happened. So basically, CBT is to try to help you go from that negative thought to that more positive thought to make sure that you are progressing. And there are different tools also like helping you pace. So for example, if you know you're going to go to that restaurant where it's noisy and you're going to talk louder, well, maybe like for a few days, you'll be a bit better about doing some of your exercises or putting maybe heat before or after, just kind of planning ahead. So as PTs, we're usually pretty skilled at helping people, with CBT resources because we see chronic pain quite a bit. But our main goal is improving function as well as reducing pain so that you can eat and talk and do all those wonderful things. But that does mean that we do have to be, trained. When you do see a PT, you want to know that they've taken many courses, that they've been doing this for a while, that they maybe work with other professionals. So it's very important to also kind of ask questions. We'll be very happy to tell you what our training is and how long we've been doing this and what we feel comfortable with. So, so even though physical therapy is an option, it has to be still with the right trained professional. And we have a whole array of tools. So this is for chronic pain. That is the beginning of treatment. If you have acute pain, so less than 3 months, that's going to be a different story. Then you're definitely going to need some more pain management tools, maybe medication, maybe also an appliance, seeing someone who's more specialized. I know we have Dr. Werfel with us. She's maybe going to give us some more examples, but this is someone who can help you kind of get over that really painful hump until you can manage it more easily. And then it's very important to remember that as professionals, we also screen for what we call red flags. So some people who have jaw pain, it is due to an underlying inflammatory or autoimmune disease. And it's very important for us to screen for that because it requires a completely different type of care. Doesn't mean that they still won't benefit from certain exercises or maybe a splint, but you really need to make sure that that condition is stable and that they are followed with the right medical team. You might be asking, well, what about images? Should I have images or not? Just very briefly, images are something that can be useful, but it is not actually recommended, except for certain cases with jaw pain. Because if you MRI'd, for example, everyone's jaw, even if you didn't have pain, you would probably see something quote unquote wrong with your jaw. Just like if you MRI everybody's back, even if somebody doesn't have pain, they might still have a disc herniation. So we have to be very careful with imaging because sometimes it can give us a false positive. So usually MRIs are only if we start to see a really weird issue, for example, with a disc, like a disc that won't unlock, something that doesn't seem right. We can use other tools like what we call cone beam to look more at the bone, especially with those autoimmune or inflammatory conditions I mentioned. But again, it's a tool. It doesn't replace the rest of the work that we do. And then if the conservative care is not enough, then again, we can still talk and have more options with all these different types of specialists. Again, this is not my specialty, and I'm hoping I'm not making a mistake, but there's different types of injections that we can do into the muscle to release it. Botox can still be a tool, but again, we want to wait. We don't want to give it right away, and it should be really done with a professional and not just, kind of, obviously you can't just do Botox anywhere for your job. It really should be done within a complete, care plan of care. And of course, there can be surgeries that are still necessary. We've come a long way from that horrible issue in the 70s and 80s with Vitec. I made a typo. That's okay. But anyways, all of those surgeries can still be helpful to help people maybe get that long-term solution, still in parallel with that conservative care. And I put sleep. We'll talk a bit more about causes, but very briefly, people with TMJ disorders are over twice as likely to have a sleep disorder like obstructive sleep apnea. So this is not the presentation to go into the deep reasons for that, but it definitely means that this could be a specialist that we might need to see, maybe with ENT as well. So as you're seeing, more and more professionals can be part of this team. This is not a solo operation. I did want to bring up something because I see this or I hear about this often, especially since I've been in the US. Good care, unless it's surgical, should not make you have to take huge loans, should not have to, make you pay the cost basically of a fancy car, unless again, it's surgical. I hear of so many people going to see so-called specialists and they're paying $40,000 for basically a mouth guard. Like that's not ethical. So just as a way to kind of know who is a good provider, I would say that's already a red flag. And a lot of people, unfortunately, who have jaw pain are not working full time. Some of them, it's a significant disability. So these are not people who necessarily have the means as well to spend so much money. And thankfully, there are some really good free resources for patients. JawSpace app is actually something new. It is very evidence-based. I know there's a paying portion, but the free portion actually offers a lot of resources. It's a wonderful app with management, a lot of the things we talked about, CBT, some like gentle exercises you can do. And usually providers will have like a free ebook, like I've made one, just with some very like basic things that everybody should know to help relax their jaw. And just really briefly, if we're talking about shifting the narrative and not saying, oh, just be less stressed, those are all myths that we should not be hearing as patients and we should not be saying as providers. There are different reasons, often multifactorial. I'm not going to go through all of them, but I just wanted to highlight some important ones. So we did talk about autoimmune, inflammatory conditions. Often we can develop TMJ symptoms as a teenager, and it's usually as a teenager that if we do have any condition like juvenile idiopathic arthritis, that is when it will manifest. So like I said, it's very important for us as professionals to screen for this because they might be one of our patients. There's a lot more research being done on hypermobility and Ehlers-Danlos syndrome due to the hypermobility of the tissues, the impact on collagen. It is also a population with a high prevalence for TMJ disorders. So it's good to know that so that we're not missing out on other symptoms that might maybe this person doesn't know that they have Ehlers-Danlos. Maybe we have to talk to their medical team to try to screen for that and rule that out to make sure that they have a complete care and not just we're just looking only at the jaw. Tongue tie is something we're talking a little bit more about. It's not the only reason you can have jaw tension, but this is something where your tongue has a hard time lifting because the tissues are tight. And there are some techniques to loosen that, but that will also usually tend to cause a lot of hypermobility in your jaw because since your tongue is so tight, your jaw has to move excessively and it can strain your jaw. Of course, trauma, obviously if you fall on your face, if you've had concussions, anytime, or you might have a car accident, those like really strong movements of your skull, well, your jaw is in your skull. So if it bounces around during these traumatic moments, it can be an issue. And, obviously dentists try to be very cautious, but sometimes people will have a TMJ flare up after wisdom tooth removal. So, it's just good to be aware. So even as dental professionals, just to make sure that they're asking or they're kind of screening TMJ disorders for their patients so they're not making things worse during a very, kind of long extraction or long dental procedure. So I did talk a little bit about those red flags because I think it's important for people to know if people are watching and they're trying to figure out who is like a good provider. Like I said, if the cost seems prohibitively high, look into it. Maybe there's some reasoning towards it, but I would say unless it's surgical, usually that's a bit of a red flag if it's like really a high amount of money. If someone is really just doing their thing, they're not willing to collaborate, they don't have a network of people that they refer to like have a kind of, like I said, holistic treatment plan, I would say that too. And if they're not willing to answer questions, like if you'd like to know, what their experience is or what they've trained, how they've trained, this is all things that we should be comfortable sharing. And there's no reason why somebody should not be answering that question. And another one that I hear a lot of is people will see a specialist and they didn't even have them open their mouth. They didn't even touch their jaw. They just asked them questions and then, wrote some recommendations and that was it. If you're having an assessment for your TMJ, we should be touching your TMJ and looking at your TMJ. I think that's a pretty minimal ask. And that's a question that you can ask. What does your assessment look like? What is going to happen? So again, we want to talk about interdisciplinary work. So if you're seeing a dentist, an orofacial pain specialist, do they also believe in conservative care? Is that part of their team? Again, to make sure that we're having really a good impact. Do they work with a sleep medicine specialist or an ENT if they suspect maybe poor nasal breathing, for example? And the same is true for example, for me, a physical therapist, like what happens if conservative care is not enough? What's kind of like my protocol? Who do I refer to? You want to be able to have these questions answered so you're seeing the right person. And again, we're going back to patient-centered. The most important thing for being a right provider is listening to the person in front of you, explaining things, communicating, setting goals. These are just basic things that every patient deserves to have, but it is so important. I hear so often people telling me, I saw this provider and they weren't really listening to me, or like I told them this, but they insisted on that, or I wasn't really comfortable with this. So, we have to be better communicators. And for us healthcare professionals, we always are being told like, wait before talking because sometimes we want to talk and ask questions, but we really need to let that person in front of us talk and tell their story because sometimes they have not ever had the opportunity to tell their story and their story is complex and really needs to be heard. So I'm hoping for the future that we can really shift towards something where again, it's patient-centered, of course. There's already a lot of great initiatives. I do believe Dr. Werfel is part of the AAOP. So there are a lot of initiatives now to bring these multiple professionals together. So not everybody working alone in isolation. So the AOP is orofacial pain specialists, but under it, there's this physical therapy branch of people who also want to help people with jaw pain. So it's nice because it's collaborative. We're working together. And more courses are including other types of professionals like body workers. So that is helpful as well. And I know research is a huge component of Fight TMJ. Like I said, I feel very fortunate to have worked on some papers, but you can never have enough research because research is what's going to help you move the needle, make sure everybody's getting the right care that they should have. And there isn't enough money for TMJ research. So I mean, I definitely was not paid. Everything I did was volunteer all those hours, but I was so happy to do it because I felt that as a clinician, if I can do this research and it's helpful, it's worth a lot. And again, we can never have too much active listening. Let us listen to our patients. And knowing that we're not working in isolation, but working together, thinking maybe, do we need to refer to a mental health professional? Having chronic pain is a horrible thing to have to deal with. Having the tools to help navigate that is something that should not be stigmatized. And so finding the right professional to help us with that is a crucial part too. There's a lot of parallels with pelvic floor and pelvic pain. So kind of also screening for that, trying to see if we can see the person as a whole. And I would say that's basically it, trying to see a person as a whole entity, not as someone with just some jaw pain, treating them with humanity and dignity and wanting the best for them. So I am hoping that, we can work towards that and, just keeping, like I said, patients at the center of the conversation and making sure that we're always doing our utmost best as professionals to give you, all the tools that you need to navigate. So thank you for listening. And Cameron, I'm going to pass that back to you. I'm going to stop sharing.
Great. Thank you so much, Dr. Victoria. That was a great presentation. Okay, so now we are going to go into a panel discussion. So I'm going to introduce all three of our panelists here. So Dr. Victoria Bednarczyk, PT, DPT, AOMTC, is a TMJ-focused physical therapist, originally from Montreal, Canada, where she graduated with her Bachelor of Physical Therapy at McGill University. From the onset of her career, she became passionate in helping those struggling with temporal mandibular joint disorders. She has completed multiple postgraduate courses related to TMJ health, including a recent myofunctional therapy and sleep coaching certification. And then our next panelist is Dr. Aimee Werfel. Dr. Aimee Werfel practices in Manhattan, New York, and is an active member of the AAOP, American Academy of Orofacial Pain. Dr. Werfel completed the program developed by the Rutgers School of Dental Medicine entitled Orofacial Pain Beyond TMD, which provides dentists with a more profound knowledge of the science of orofacial pain and jaw-related disorders. Combined with the experience gained working at New York TMJ and orofacial pain for several years, Dr. Werfel has developed a deep competence in diagnosing and treating patients who suffer with these conditions. She places considerable attention to individualized care, patient education, and lifestyle management for positive patient outcomes. When she is not practicing at New York TMJ and orofacial pain, she volunteers as a clinical attending at the Weill Cornell Medicine GPR program to educate dental residents and treat patients suffering from orofacial pain and TMJ dysfunction. And then finally, we have Jessamy Cunningham. Jess is an undergraduate health science student from Australia who underwent a total jaw replacement in her right jaw in November 2024. As part of her recovery, she hopes to use her knowledge and lived experience to bridge the gap between patient and professional in the TMJ space. Jess is also a dear friend of Fight TMJ. As one of our first patient advocates who shared their story with us, she remains as a valuable partner that pushes for compassionate, humane, and dignified care in the TMJ community. Alrighty, so we've got some questions here. Okay, so it's just a couple guidelines. Let's try to keep the answers concise, 1 to 2 minutes each. Um, feel free to respond to one another. There's a dialogue, not a lecture. Um, and I'll just cue each question and direct responses by name. And then we don't have an audience right now, so okay, we'll just dive into the first question. So this is for Dr. Victoria. From your perspective as a PT, what was the biggest misconception about TMJ disorders in the earlier decades?
I guess I briefly talked about that. I would say probably not putting enough emphasis on both patient-centered care, just kind of saying, okay, well, you need a surgery, or forcing maybe another type of treatment, even if the patient wasn't feeling like it was helping, or definitely miscommunication, not explaining what something does, what the risks could be. And again, because I'm biased as a physical therapist, I would say definitely, unless except for that really short period apparently during the 50s and 70s where I was not practicing, definitely not enough emphasis on the muscles. I mean, the jaw cannot function unless you have good muscle balance. So I would say that would be like my main ones.
Interesting. I just had a question about your presentation. You mentioned that there was mention of TMJ in like ancient Greek texts. Did you do you know if any of the treatments that they use are kind of similar to anything you do today, or
I
just
did
out of
not do a deep
curiosity?
dive, but that is
Yeah,
actually a good question. So maybe that's something I'll put for like an Instagram reel or a
yeah.
post. But I know that it was definitely ancient Greece and ancient Egypt. And I know in ancient Egypt, they were really good also at like illustrating with hieroglyphs. So I'm wondering if also we get a little bit more. So thank you for reminding me to actually do a deep dive into that. So I hope to be able to share that information at a later date.
Okay. Um, so let's see here. Do you guys have any Dr. Aimee and Jess, do you guys have any comments on that first question? Do you guys want to add anything?
I'm not so familiar with that one.
Okay.
I mean, you're talking about, I'm
No,
sorry,
no,
can you
not my
repeat that
question. That was
question
just a
again?
that was just a I guess the misconceptions about TMJ disorders in earlier
Oh, yes. I
decades.
mean, I think Dr. Bednarczyk really covered the topics really, really nicely in terms of misconceptions, even now. But I agree. And one of the major ones was a huge focus on occlusion and an overly, I would say, overly analyzed emphasis on bruxism being, a primary issue that's a local factor. I mean, now that we know bruxism is no longer primarily localized, there's actually a centralized factor. So it means that the brain is also responsible for a lot of this. There's actually a limbic system that's connected to it. So when we talk about parafunction, which is something that could be a whole other discussion, or that could be grinding, gnashing, that could even come in the form of nail biting, cuticle biting, all these things that the jaw does beyond, talking, eating, natural, really critical functions. We're now understanding that, it goes well beyond just grinding in your sleep, grinding during the day, and how teeth come together. So I agree that is a major one that we've progressed from.
Yeah, and I would add, I think I ran into pretty much every one of those issues myself in trying to get my TMJ treated now. And I really had to push at every stage to find out what I should be doing. And I think one of the only reasons I could is because I have a background in health science and I knew enough to say, well, that's not good enough. I'd like an alternate perspective, or I sought out my own physical therapist. So all of that stuff I had to push for even today. So it's definitely it's encouraging to hear to have this discussion because it's an ongoing problem. Yeah.
Okay. So this question is for Dr. Aimee. Dentistry played a huge role in early TMJ care. Looking back, what well-intentioned practices might have been or might have overlooked the bigger picture?
Well, one thing I would say is going back to the kind of tooth-based focus. You know, I think there was an overemphasis on how teeth come together, and that's still a philosophy that's shared with other organizations. The AAOP really follows a broad biomedical emphasis on oral facial pain and TMJ issues. But I think the overemphasis on how the tooth orientation is and those impacts on the jaw and its functions. You know, we see many patients that have various levels of malocclusion, which is what we would call it, where the teeth may not come together in an ideal form. And that is always not always linearly correlated with their symptoms, you know. So I think that is one factor. And also imaging has come a long way. So, you know, previously, you know, we were using images that were primarily 2D. Now we have 3D capacity with cone beams. We have MRIs that can really allow us to assess soft tissue. So it's going really well beyond the dental scope. And we're able to see like a broader image that incorporates more of a medical and holistic approach to the patient.
So this one is for Jess. As a patient, have you felt the effects of older beliefs? I think you touched on this a bit, like being told it's just stress or to live with it.
Yeah, I mean, I think I heard most of what was in, like, most of the bad things you can hear. My least favorite was you're just sensitive. Um, but yeah, you're just sensitive. You're just stressed. Um, and the worst was after an MRI, which came back with my disc all torn. I asked to be referred on, and I really had to push for that. It took months, and by the time I saw my surgeon, my jaw had started to fuse shut. So, yeah, it's hard for me to even think of all of the things that were said on the journey for me because it was just endless kind of invalidation and skepticism and a lack of good information like don't no one told me to see a physical therapist is that's the other big one. Yeah.
Okay, and this question is open to everyone. Um, how can reflecting on the past help to rebuild trust between patients and providers today?
I mean, I guess I can start. And I do want to thank Jess because, you know, you are sharing a very vulnerable thing that happened to you and the struggles that you had. And you are a patient of the 2020s. And so I think it just goes to show that, you know, the care of TMJ and kind of like the modern era is just under 100 years old. And, you know, I would really hope that things could move more quickly so that, you know, you, for example, did not have to go through that. And I think there's a big amount of work that we have to do to, I guess, I mean, to regain trust. I mean, I think it's about communicating and letting people know that we are their advocates, that we are working with them. You know, we're not trying to just, sell our wares, that we're here to just help them navigate. We do have experience as professionals, but that also we're there, you know, to coach them and to support them every step of the way. And I think that goes a long way when people feel heard, feel supported, they can ask questions. I mean, the amount of questions I know I get in my practice, it's, you know, because people don't usually have that opportunity. People don't see multiple professionals and like they have a very short period of time and they can't ask all the questions. And so I end up having to sometimes research like, okay, well, post-surgically, can this happen? Like, I'm not sure. I guess the surgeon should tell you that, but it's really to take on that role of advocate with the patients, and I think that can help through all the different professions rebuild some of that trust.
I think I can add to that as well, and to Dr. Bednarczyk is, we've got a much more broader and stronger team than we had in the past. As you had mentioned, the American Academy of Oral Facial Pain, and then we have these specialized physical therapists that are now a lot more, that are growing in numbers and growing in availability. We've got a lot more access to specialists that actually know how to address these conditions with a variety of ways. It's not just, everyone gets an oral appliance. It's not everyone gets Botox anymore. Everyone is really assessed on an individual level. And if you, find a provider that's willing to hear you and listen to you, and then also really take the time to provide a whole outline of treatment options, that's really important. And that's what we're moving towards.
Yeah, I agree. I think a big, which really reflects what's already been said, but making the TMJ feel like less of a mystery to patients, and making patients feel heard, that really ties together the physical problem of TMJ with that social and psychological side, because I think until you feel heard and until your condition makes a little bit more sense to you, the anxiety is worse, stress is worse. You can do CBT and it's a good idea. But for me, when I saw my surgeon finally and he sat down for an hour and said, this is what's happening, this is how it works, this is what we can do. And I went away really feeling like I got it from my disc to my joint. All of it made sense. My anxiety and my feeling around how much control I had over my life, let alone the trust I then had in him, like everything came together for me even outside of the appointment, even while I was waiting on surgery in pain. I just felt so much better that I was heard and validated, and it wasn't a mystery. It wasn't this nebulous thing that I could never get on top of. Yeah.
Thank you. Okay. So we have a couple more questions here. So these are about what care looks like today. So I'll start with Dr. Aimee. TMJ care lacked clear clinical guidelines until recently. How have these standards influenced your work?
Can you repeat that question?
Yes. TMJ care lacked clear clinical guidelines until recently. How have these new standards influenced your work?
Okay. It's, I have to say the American Academy of Oral Facial Pain is becoming a much more recognized organization. And there is a whole clinical handbook that we really update um, routinely. And this is something that really provides both providers very clear guidance, specialists, but also, us as specialists go out there and we're educating the public, we're educating other doctors, speaking to patients. I mean, a forum like this is fantastic. So I think going back to the question that was asked, we're constantly looking at new research and go attending routine scientific meetings to stay up to date.
Would you like to respond to that question as well?
Yeah, I know that, physical therapy, things have changed a lot. Before it was like, we need to relax all those muscles that are tense, relax, relax, stretch, stretch, stretch. But if you don't support other muscles, you're just stretching in a void and you might actually irritate someone more. So even as physical therapists, we are seeing, our profession evolve into the understanding of like better muscle balance, calming down the nervous system, looking, like I said, into other parts of the body. So like, how is someone breathing? Do they have even pelvic pain? Two areas that can really work against each other. Is there other generalized hypermobility that needs to be worked on? Maybe somebody has a lot of weakness and hypermobility in their shoulders and they're bracing everything and that's making their jaw brace. So we're much better at, doing a very much more in-depth assessment, asking more questions and making sure we're not just, okay, we're just going to relax your jaw and, move on your merry way, because that's a very short-term way of looking at it and a very incomplete way of treating someone.
Thank you. Okay. All right. So this question is open to everyone. Collaboration between dentistry, physical therapy, and patient education is now key. How does that change outcomes for patients?
I think having a very strong team available to the patient is really critical because, I consider, the diagnosing doctor, whether it be, physician, dentist, physical therapist, that is really where the patient starts with whoever they're first seeing. They can receive a clear diagnosis and then get referred to the correct avenues. That really sets forth a good healing plan. So, working between the orofacial pain specialists that could potentially provide maybe acute therapy, like through the form of pharmacotherapy or the right medications, or if it's more severe pain with limited opening, something like a therapeutic TMJ injection, whether it be with steroid or something regenerative, that could set the patient forward, for example, before they see a physical therapist that can then rehabilitate them from an acute inflammatory response. And so it's very important, especially where you are locally, to know those providers, know those trustworthy physical therapists, or whether it be acupuncturists. So there's a whole team that we work with, and knowing more predictable outcomes of how your patient is going to be treated.
Yeah, that's a great point. And that is now what I'm hoping to establish in Boston, because in Montreal, it was really great to be able to have my network and say, okay, somebody is clearly, usually these providers would know not to send me someone too acute, but sometimes they did accidentally, and I would have to refer back and say, look, they're not ready. We need to get those pain levels down, or instead they would say, well, before I give them an orthotic, why don't we try seeing if like a bit more muscle balance makes them feel quite good, and then we don't need to, have them spend money on something they don't really need. So, working collaboratively, just trying to put the patient at the center of it. And I think for a patient, hopefully, knowing that, a lot of people are on the same page, kind of like what Jessamy was saying, might help, feel that support, therefore feel less anxiety and not having, to worry about, well, like I have to figure this out. I have to do my own research, because we specialists are actually talking together and we know what we're talking about.
And then building onto that, I'd have to say too, and you have a team that you're already collaborating with, there's really easy avenues for you to discuss updates based on your appointments with the patient. And this can be really helpful because now you've got different perspectives of the condition, and you've got somebody that's saying, for the physical therapist, looking at the neuromuscular side of things, or maybe they see aspects in distal parts of the body that the oral facial pain or the dentist is not seeing. So it's something that's really, really helpful overall for the patient, and it's just a way to clarify the medical jargon or the diagnosis that they may not be able to convey themselves.
Ready. Move on to the next question. So this one is also open to everybody. TMJ care can be very costly. How can practitioners, organizations, and advocates make it more accessible?
Well, there is a lot of advocacy that is underway, and it takes a time, it takes a process. But I have to say, establishing recognition through insurance and so that they understand what the TMJ conditions are is a major step, because so much of this is not covered by insurance. So that is something we are working on.
Yes, that's something I'm learning about now that I'm in the US and not in Canada, because it is a different model. Jessamy, I don't know, you may be able to share your experience in Australia, but I know that, for example, I had a patient last year who had a total jaw replacement bilaterally, and she was on a forum on Facebook with people who were going through similar things. Most of them were in the US, and she was like, I feel so grateful that this is actually covered and I'm not spending, multiple sums of money on this. And kind of like what I talked about in my presentation, I think we should be paying for care if it's the right care, but at the same time, I do hope, kind of like what Dr. Werfel said, that we can have insurance in the US be a little bit more open-minded, and maybe if they understood a bit more, maybe it doesn't have to be nebulous to them. Unfortunately, I don't think I have a big um, role that I can really play in that, but I think for patients, it's to also, if you have a good provider who listens to you, I always tell people, anything that you do is better than nothing. So, for example, as of now, I'm out of network. I don't take insurance, but I believe in having things accessible. So, if, for example, you can only do a certain amount of visits a month, not a problem. I believe in empowering people, giving them tools and resources in between sessions anyway, because I'm not with you every single moment of the day. It is what you do a bit every day that will make a bigger difference. So there's always a way to make it work. And I think it's important for us to be sensitive also to people's budgets, because that is a great area of stress. And I don't think that as professionals we want to increase that stress. I mean, obviously certain things still have to be done to a certain extent, but I think it's good to kind of try to listen to people and see, how can we still make sure they get care, but there isn't like a financial burden.
Something I think to keep in mind too is that many, given maybe aside from severe arthritic degeneration, most of the acute TMJ issues that we see do improve over time, as long as there are factors that the patient is doing that is promoting healing, whether it be through treatments that we can provide, or self-care that they're employing at home. But the upfront cost may be higher, but something to really appreciate is that that's not something that has to be ongoing throughout your entire lifetime. The goal is that we're trying to really address the issue at hand so that long term you are stable and you're living a much more comfortable life.
Yeah, and I would add for patients, I found not necessarily support groups, but just the Facebook page, Reddit, social media, where you could talk to other people, ask what they've done or who they've seen. Very quickly, I've found patients able to weed out professionals who maybe didn't have a good bedside manner, or that's not really helping with the cost. But I've also seen people say, well, this person will take your insurance, and because most of the support is in the US. So for patients, I think those small organized communities can be really empowering, just to help that initial step of who do I even trust in the first place, and who will try and work with me and make it as affordable as possible. Like, it's a big weight off your mind, I think, particularly for the American, because yeah, it's different where I am, but it's still a complex system to navigate. Yeah.
Definitely. Thank you for sharing that, Jessamy. I think another thing to add to that too is the forums are great because patients can really provide real feedback, and be very transparent with each other. And I think, as well, more than anyone, that this type of care has to be very specialized. It's not just, you can't go to any dentist and expect a comprehensive treatment plan for something like this. So it takes a lot of time for providers to really specialize and educate and invest in learning and being able to treat this properly. So there are a lot of providers like Dr. Bednarczyk and myself. I am also fee for service by design, but I do accommodate, where I can, because we want to be able to spend the time to be able to talk to you and see you. And the insurance system, unfortunately, really limits our ability to spend that time. So it's something that we're working on, and there are, a variety of accessible resources out there depending on what you're able to do. If you want to be seen sooner, have a lot more one-on-one specialized care. There's opportunities for that if you're willing to wait maybe for a longer period of time. There are hospital systems that do have providers that can provide care as well.
Yeah, that's one of our goals coming up here. We're gonna create a map with a bunch of different, providers in various cities based on patient recommendations. We've already got a couple, but we don't. We're gonna need, hundreds, and maybe some sort of review system on the website where people can describe their experience and how they help them. Because if you type in TMJ resources, a lot of times it just pulls up like a ton of different people, and it's really hard to sift through it all. So that's one thing we're going to try to work on here in the next couple of months.
That's great.
Okay, so thank you guys. Next question. So these questions are about the future, TMJ care. So I'll start with you, Dr. Victoria. You mentioned the TMJ isn't an island. How can we help patients see that it's connected to the rest of their health?
Yeah, I think it's a little easier now. I think a lot of people are, maybe through just popular culture, there's already a bit of a sense of, holistic care. I think some people are also very more minded towards that, so they're more open to it. I think for other individuals who maybe aren't used to it, maybe a slightly older population, they might not see the relevance of certain things. But I think, you can always tie in, if you do a good assessment and you listen to someone, usually there's already clues that there might be something else going on. So for example, if, I always like to ask people when they come, I'll ask them other things like, how's your back? How's your hip and other things. So, if somebody does tell me, wow, well, I didn't think we were going to talk about this, but yes, I've also had, back and hip pain for like a really long period of time. And, but I didn't think we were going to talk about this. So I think when you meet someone, it's always good to just kind of ask little screening questions just to get a sense of, is there something else? Obviously, because of the prevalence of sleep disorders and job pain, I will always ask someone, how are you sleeping? And for some people, that's not a factor. They sleep fine, everything is fine, but for quite a few of them, it's not fine. And so then it's also to see, okay, well, that's okay because we can actually work on getting that better as well. And whether it's just through exercises or maybe they do need to see like someone for a sleep study if we see that it's really something more severe. But I think people will be more open to it not being an island. And I think to them, it'll actually resonate because they'll be like, okay, that makes sense because I've also been feeling this. So it's not just all in my head. Like this actually makes sense. This is actually connected. So I think once you dig a little bit, people are actually quite happy that you actually did the detective work and that you were able to help piece all those puzzle pieces. And sometimes it is, you know, like I said, if you have, an issue and it can be very isolated, but, usually there's multiple factors, whether it's, psychosocial, whether it's, another body part, whether they maybe have hypermobility or a sleep disorder. So it's our job as providers to just do a really good screening tool so we're not missing anything. And like I said, I think people are open to that because they see that we're really trying to get to the root cause of what's happening.
And if I'll quickly jump in and say that's completely my experience. And I went in for my jaw to physical therapy, but I was told, look, you really need to do a full body exercise program because of hypermobility. And I kind of rolled my eyes and went, great, I hate that. But after 2 or 3 sessions, especially my neck, I could feel the difference and it was explained to me. Now I go twice a week and I love it and I feel the benefits. So it didn't take much convincing, even though initially I went, oh, yeah, everyone says that. But I did it and it was great and I so appreciate it. Yeah.
Thank you, Jessamy. Thank you for sharing.
Okay. Let's see. So this one is also for Dr. Victoria. How does empathy make evidence-based care more human?
Trying to wrap my mind around that question. Well, so as in, how do we make evidence bear more empathetic, or how does
So let's just
empathy?
skip this question,
Okay,
maybe.
that's okay.
Um, some of these were from our Instagram followers, and then yeah, okay. Um, so this one is for Dr. Aimee. How can dentists learn from physical therapists, psychologists, and other specialists to improve care? I think that's a pretty good question.
That's a great question. We're doing our assessment, we're doing our screening questionnaires. Um, so it, but we gain so much information from the physical therapist when they're assessing other aspects of the patient, especially. They're going really deeply in there with the muscles. They're doing their intraoral assessments. They're really tactile. I worked with a physical therapist early in my training, so I can really appreciate that. There's just how much you can learn from your hands for physical therapists. That's a huge part, and they convey that information to us, so then I can better address areas maybe that they couldn't through manual therapy. For example, treat with trigger point therapy, which is a type of needling therapy that's different from acupuncture, and it's directly attacking the knots within tendons or muscles, so that now that's released, they can go back to the physical therapist and then continue with their manual therapy. Or with psychiatrists or psychologists, they are very helpful in terms of providing therapy to the patient for pain management long term, whether it be CBT, as Dr. Victoria had mentioned, or providing at times when it's needed therapeutic medications to manage, whether it be anxiety or depression, and that could be short term or long term. So, the whole team dynamic is really important there. Yeah. And I'd also add that we do collaborate on medications and dosages with other providers as well, depending on what we see. So we exchange information very, very frequently.
Dr. Victoria, do you in your when you lived in Canada, did you have a dentist in your network or
Yeah, so I was quite lucky. I had um, a dentist. I don't think he was an oral facial pain specialist, but he was very TMJ care oriented, and he really believed in, you know, having multiple professionals working. But then I also eventually ended up working with some facial pain specialists, and most of them were quite open, kind of like with what Dr. Werfel was saying, is that, for example, there are some patients, like I said, they still need trigger point injections or Botox. And so I could say, okay, well, as we're trying to help those muscles, they still needed those injections to kind of tie them over until we could really, get that right muscle balance. And so that's what I was able to do. I would literally just like write to them and say, like, okay, you might still need to address these areas because there's still areas of concern that we're still struggling with. And thankfully, at some point, the patient would need injections anymore because then they were able to complete all the work. Muscles were happy, pain was less tension. But yes, I was able to work with quite a few different providers, surgeons, ENTs, orthodontists. So it was nice because the patients really got like such good care because they had a team of people that could work with them, and they did really well because of that team.
Jess, did you ever see a dentist? Or were they uh helpful or unhelpful in referring you to other people
Uh,
or
I saw an orofacial pain specialist who tried his best, but um, couldn't really help because I was, my case just happened to be beyond his expertise. So he had a go, but I don't think the the professionals here, at least in my city, really contact each other that much. So I had to do the the bridging to get to see a surgeon and to see a physiotherapist and all of this. So yeah, I didn't have much luck with a dentist. Yeah.
yeah, I think probably a lot of people run into that. So you guys have mentioned Botox a couple times. I just had a question. So we had this follower on Instagram who commented on one of our videos. I think we did a post about Botox injections a while back, and they commented with sort of this like horror story TikTok where this person had received Botox injections for their TMJ, and then the Botox, I forget what it was called, but it had like somehow leaked into the rest of their body, and then they weren't able to like eat normal food, and they had to have like a feeding tube, and it was just like this horrible thing. And she was like, you shouldn't recommend Botox, but I've heard both of you guys recommend Botox. So I'm just kind of wondering, how common is that? How much of a risk is that? Like, because I don't want to be, obviously recommending any, thing on the Instagram that could have, potential, risks like this. I mean, it was horrible. Like she had to eat through a feeding tube for like years, and it was just like, oh my gosh. So do you guys have any experience with that, or do you know kind of the risk of that or anything?
I, I can speak for that. I do treat with Botox. That's very unfortunate that that had happened to her. Fortunately, it is quite rare, but we do have to understand that it is technically a neurotoxin. So if something like that does infiltrate, major vascular, um, if that is entering, their veins or their blood vessels, and it becomes systemically distributed, that's something that can happen. It is a risk factor patients should know. Um, but I would say that that is very, very rare, and where we commonly are treating are within the major muscles of mastication. Unfortunately, the masseter muscles, normally when we are treating, most of the time are quite hypertrophic or well developed. So we have a clear idea of where we are. But once again, it's important to really find a doctor that's very experienced, is able to really explain all of the potential side effects to you before you start, so you can determine if that's the right way to go. Another thing that I can add to that is it's really not a first line therapy for most of us. We don't start with Botox typically. We're starting with physical therapy. We're starting with self care, self regulation, behavior avoidance, maybe even oral appliance or orthotic. And when there are behaviors or factors that are beyond both our control and the patient's control, that's normally when we turn to Botox. And I'd have to say something as unfortunately as detrimental as what happened to this person is not something we typically see.
I think that was really well put, because I was thinking perhaps the provider, we know that anything invasive has a risk. And, I know that can be a tool, but again, it's like Dr. Werfel said, it's not the first thing that we do. And I talked about that on my presentation, but for some people, it can be a way to like really help them move forward. And that's why we have a tool, like multiple tools to help people. But I do believe that if you have the right provider and they know what they're doing, it's like when you go for a surgery, you want to know that, yes, there are risks, but I trust this provider. So those risks, which are low, are still even lower. So I really feel for that person, because that sounds horrible, but I would also kind of wonder who that provider was, what was their training, because I think, usually when you're seeing someone, like for example, I'm sure Dr. Werfel, she knows like where to inject and where not to inject. So, it just is such an unfortunate thing that had to happen.
And I'll add to, I mean, even, as trained as a provider can be, there are times where something can happen that's unexpected, unfortunately. And just, our bodies are very complex. There are a lot of, um, there's a lot of vasculature that runs through the face, a lot of nerves, so it is something that, like I said, it can happen, but fortunately, that's not something that we see commonly.
Hey, yeah, I was wondering about that. It was kind of worrying. I was like, but yeah, I'd seen it recommended, so it's interesting. But yeah, it's good to know that it's rare. Okay, okay, so this is for Jess. What should clinicians understand better about the patient journey, especially when treatment feels overwhelming?
I think clinicians, uh, I think everyone I saw had the best intentions, but some don't always acknowledge or want to, maybe they're not trained to grapple with the emotional like side of even the trauma of people are coming in, they are low on information, they might have seen the wrong provider, and they often have assumptions that they're not going to be listened to or they're not taken seriously. It's very such a sensitive topic. And I think it's really helpful for that to not be taken personally and to be patient with people who come in, because there's that history there that makes the initial building of trust a little harder for some people. And yeah, I think that's on patients as well to go in with an open mind about, well, this experience could be different. Um, but yeah, the emotional burdens of treatment, I think, actually, I don't really know what the answer to that is, but I don't think there's any understating how tough that can be on patients. Yeah, I don't know if that answers the question.
No, I think you put that really well, because I've seen that a lot. People will hold information back or suddenly get really emotional because like they're talking about something that is really horrific. And I think it's just so important to create that safe space and like I said, to actively listen and to say like, you know, I, as this type of professional, I will do my best. I may not have all the answers, but if I don't, it's okay. We will find this together. You're not alone. And I think just hearing that, it means a lot to people. And, that's why like I don't have short assessments, and sometimes, things go over because we end up talking more or they just need more time because like they're, a lot of emotions are coming through. And like I said, when you're talking about jaw pain, it's very it really impacts your quality of life. Like I'm sure just you obviously know this. And so, it's not like, oh, I just stubbed my toe or, even if you have other, issues, it's your face is so sensitive already because of the nerves, the types of nerves that are there and the function. So I think if we're going to go in this type of profession, we really have to, be additionally generous, additionally empathetic, listen extra because a lot of the time that is not happening with other professionals.
I'm
Yeah, and
sorry, one more thing is that I think the phrase like it's stress, even just stress factors in. I feel like that's so loaded for patients. And it's important that they know that stress does matter and emotions do matter and CBT is a good option, but um, delicate phrasing around the impact of that is important.
I think people need to be like aware that, like one treatment method may not work, and I think that really sucks. Like for my brother, he saw multiple people and I think he got a splint And I think he was really banking on it working, and it didn't work, you know. And I think it can be like a huge blow because you're trying to, you just want to get relief, and it worked, and it really was bad because it worked for a while. It worked a little bit, and then it stopped working, and then he just spiraled into depression. And I think it sucks that you have to acknowledge that, but like, you may have to see like 3 or 4 different people. Like Jess, I know when I spoke to you, like you went to like several different people, and then you had a surgery, and it worked, thank God. But even the surgery may not work, and it just is sucks. But you have to kind of temper your expectations, I guess, and just be aware that it may not work with the first provider. And I think
Right.
it's just and providers should kind of let people know that too, that we may have to go in another direction. We can try this, but that doesn't work, we'll try something else. So
Yeah. Cameron, I think that's a great point too. I often set expectations for my patients, and when I see something that might be irreversible or something that's a long-term management type of thing and not just healing from a sprain, I have to say little relapses here and there, especially if you've got a disc displacement or a clicking or locking disc. That's something that can happen even after stabilization from time to time, depending on the situation. It just takes yawning the wrong way, or maybe there was a more intense, stressful period, and there was a lot more activity with grinding or clenching that week or month. Life happens. And we can have relapses. And the important thing to know is if you have a good routine, a home plan, that should work as long as you're really able to defer to that or see your doctor, your provider as needed.
thank you guys. Okay, so let's see. So here's some audience questions from some of our followers on Instagram. So this one is open to everybody. What are the latest advancements in understanding TMJ disorders, particularly in terms of root causes rather than just symptom management? And maybe Dr. Aimee, if you want to start.
I mean, I think I did briefly touch upon this before. The imaging that we have at hand has come a long way. So we've got a lot more diagnostic power, whether it be through CBCTs, the 2D image or 3D images rather that we take, or MRIs. It traditionally years and years ago, an MRI was not really as available as it is today.
Yeah, and I think that's why I wanted to talk about some of the, root causes that we also screen for, because, since, there is still some research and there's still some clinical kind of links to understanding a little bit more. Okay, well, why would someone with hypermobility be more prone to having TMJ, or why if you have a sleep disorder, you might also have like, jaw pain, jaw tension. So there's definitely more that we're like, I always like to say, like, the body itself doesn't change, our understanding changes. So I think there is not enough, but there's more of a push to understanding those underlying causes, as opposed to, like that person said, and like I kind of have mentioned before, like the old physical therapy way of just like, let's just release some tension is no longer sufficient.
Mm-hmm. I think there's a lot more in a interprofessional collaboration too. We're working with other medical providers, whether it be a neurologist, an ENT, a rheumatologist, to really assess, is this really truly the joint, or is this possibly even a type of headache disorder that is manifesting in the joint? Or is this something that's rheumatologic, or is this a EDS or hypermobility disorder that's impacting actually the whole body and not just the joint, but the joint is what's become most symptomatic at the time. So we're understanding that, we need to really look at the whole person and not just the TMJ. And sleep is a big one too.
We post a lot of different things on Instagram about different areas of research, and it just can seem overwhelming, honestly. Like, there's Botox therapy, there's like disc replacement therapy, there's stem cell. I mean, there's like, so many different areas. I mean, it's impossible for anyone to be, an expert on everything. So yeah, I do agree. Like, we need to have more collaboration between researchers, and that's kind of one of our goals. But yeah, okay. Um, okay, let's see here. So this one is open to all. How can patients advocate effectively for proper diagnosis and treatment, especially when symptoms are often misunderstood or dismissed?
So I actually have a post on my page, my Instagram page, about pain journaling. And I think that is really helpful because if you're able to clearly explain the symptoms that you have and the history of your symptoms, it's a lot easier for the provider to be able to assess the full picture and see what's happening.
Yeah, I really like that. And I mean, I always try and toe the line as a patient between looking over prepared and or like too enthusiastic. You don't want to come off that way. But what I've started doing is I've got a running list of this is my physical therapist, this is my surgeon, this is my pain specialist, this is how I'm functionally impacted. These are the things I'm doing myself. And so, because the communication isn't quite there with my team, when I see someone new, I go in and I don't hand them a list, but I say, here's why I'm here. This is what's going on. If it's of use, this is my information. Um, and the thing I always try and remember is if I have an appointment where I know that I've communicated well and there's been a big disconnect, also not blaming myself automatically for that. Like, it's a collaboration. So, what could we do next time to better see eye to eye? I think is really important for the emotional side of these partnerships. Yeah.
Yeah, you both bring really good points. I don't think I can add to that. That's really great.
So we just have a couple more questions. This one is open to everyone. Are there emerging therapies or multidisciplinary approaches, e.g., dental, neurological, physical therapy, that show the most promise for long-term TMJ management? That's from one of our followers on Instagram.
I think it really depends on the diagnosis. But if you've got a chronic condition, there are regenerative therapies that are coming out now that are having a lot more success. I think the research and the real life broad application of it is still underway. It could be very different based on the provider that's giving that treatment, but we're seeing a lot more of an approach for regenerative medicine, and that can come in many forms that we could probably talk about in another lecture after today.
Yeah, and I think for long-term care, I mean, the goal is to, depending again, as Dr. Welfel said, what's the diagnosis? But I think most people, unless it's something where there's like an autoimmune issue, where there's like significant flare-ups, usually you can have people really manage very well for like a very long time. And like she said, there can be life events that can flare it up, but at least that person knows, you know what, I've seen that provider or these providers, they've helped me get over this, so I'm going to be fine. So I think just, if you have the right team behind you and you're given the right tools for managing it, you can really have very good long-term management.
So this is the final question. I know that you guys probably have to go. So, okay. So open to everybody. What strategies can healthcare professionals use to better educate the public and other clinicians about TMJ and its misconceptions?
Mm. Um, I know personally, I often meet, you know, with other specialists, either one-on-one or other doctors one-on-one or in group, um, networks where I'm able to share this knowledge and information either through lectures or through um, connections. So we are trying to get out there. I think the AOP is also really working on patient advocacy and getting more information out, both for providers and for patients.
Yeah, and I think, obviously Fight TMJ is a great way to kind of create awareness. And I know that, through social media, it's another good way. I just recently taught to or presented to some physical therapy students to talk to them about like TMJ care and also sleep health. And, one of the students mentioned to me, well, I asked my dentist multiple times if there was anything else I could do besides wearing a splint for my clenching, like any exercises. And the dentist clearly told me, no, there's nothing you can do. And I was like, oh, we still have quite a bit of work that we have to do. So I think, it's a tireless effort of like, as Dr. Welfa said, meeting people, lecturing, educating. I think a huge part of what we do and what we enjoy is, spreading awareness and making sure people know what is, I guess not the right, well, yeah, the right way to take care of someone when they come to you and they're, talking about their pain.
Yeah, I think that's like one thing you guys are doing, what we're trying to do as well on social media is kind of, it can be, daunting to try to read like an academic journal or something, and it's just not practical for most people, but trying to break it down into little, bite-sized pieces of information or like a, short video, to make it more accessible to people, so they can sort of help themselves, I think is a good step. Jess, do you want to add to that question?
I mean, I think everyone here already knows this, but I guess a big part of what I've been doing with my degree, because I do research too, is um, learning how to speak in plain language, which has been done really well today, but it is a skill. It can be really hard to convey complicated concepts and ambiguity in a simple way that everyone, even if maybe English isn't their first language, or, people can easily understand, and that really matters. So that's all I'd add. Yeah.
Well, do you guys have anything else you want to say? We're past 4:45. I know Dr. Werfel has to go. But yeah. I just want to thank you guys for coming on. I apologize for the late start and the technical difficulties. And I've never done a webinar before, so I know it was a little rough, but I really appreciate you guys coming on. This is great. And I'll send you guys a recording. Thanks so much for the presentation, Dr. Victoria, and just, for taking some time to do this. I know it's probably the middle of the night for you, Jess, so really appreciate it. But yeah, that's all, thank you guys so much for coming on, and yeah, hope to talk to you soon.
And thank you, Cameron, for your work, your advocacy, how you're honoring your brother. And hopefully we helped a little bit today to create more awareness. And thank you both, Jess and Dr. Welfa, for, being here with me today as well. I'm very honored, and I'm glad we were able to hopefully bring this message across that, we can do better, and we are trying to do better for care.
I second everyone here. It's been fantastic. Thank you for having us, Cameron.
Yeah, thank you guys. I really appreciate it. Okay, well, thank you very much. Have a good weekend, guys.
Thank you so much, everyone.
Thank you.
Okay,
Thank
bye.
you. Bye.
In recognition of all our speakers' efforts, Fight TMJ would like to commend the Certificate of Appreciation to Dr. Victoria Bednarczyk in recognition of her valuable contribution as a keynote speaker for Fight TMJ's The TMJ Collaboration webinar episode entitled First Steps, Shifting the TMJ Narrative, signed by Cameron Maltby, Fight TMJ founder and executive director, and Maureen Dumanlag, the organizing committee head. Next up, Fight TMJ would like to commend the Certificate of Appreciation to patient advocate Jessamy Cunningham in recognition of their valuable contribution as a panel discussant for Fight TMJ's The TMJ Collaboration webinar episode entitled First Steps Shifting the TMJ Narrative. Signed by Cameron Malby, Fight TMJ founder and executive director, and Maureen Bumanlag, the organizing committee head. Finally, we'd like to commend the Certificate of Appreciation to Dr. Aimee Werfel in recognition of their valuable contribution as a panel discussant for Fight TMJ's The TMJ Collaboration webinar episode entitled First Steps Shifting the TMJ Narrative. Signed by Cameron Malby, Fight TMJ founder and executive director, and Maureen Bumanlag, the organizing committee head. To all our valued speakers and partners, we'd like to thank everyone's participation in our inaugural episode for the TMJ Collaboration webinar series. To our audience, we hope that this episode helped you better understand the past, present, and future of TMJ care. Thank you for supporting Fight TMJ. We hope you learned a lot from the webinar, and we highly encourage everyone to check their emails for your post-event kit. From the bottom of our hearts, we invite everyone to helping us raise awareness, engage in advocacy, and take action to fight against TMJ. Follow us on our socials for more information, or check out our website at fighttmj.org.